Hi, my name is Mimi Choy-Brown, and I'm an associate professor at the School of Social Work at the University of Minnesota. I'm also the MPI and lead evaluator of a Category 3 center, the Circle Project, led by Dr. Saida Abdi. I'm joined today by doctoral candidate Laura Soltani, who's been working with the Circle Project since 2021. We would like to share what we've learned about the critical importance of attending to trust and power while implementing a multi-level intervention to support resilience among refugee and immigrant youth across their communities, schools, and mental health agencies. First, I'm going to share briefly about an implementation strategy that we adapted, and then Laura will share about how power and trust worked to support the integration of that intervention, as well as the resilience of youth and families. We drew from existing implementation science evidence and community-based participatory research, or CBPR, approaches to develop an implementation team. Developing an implementation team was really what best matched the key determinants in our project, particularly given the cross-system collaboration across 8 different public schools, 3 community-based organizations, and our university team. If you're interested in learning more details about the evidence and practical how-to guidance, there's certainly a lot out there about implementation teams, including in the NCTSN implementation video series. For this project, our team's aim was to ensure that people really liked the intervention, were engaged and motivated to use it, and really used it as intended. We adapted the strategy by integrating that CBPR approach, specifically in which power sharing, mutual respect for expertise, collective decision making, and shared values were essential to the implementation team. So the establishment of the implementation team generated protected time for interactive and collective problem solving and support for the kind of interdisciplinary group of people who are implementing the intervention. In this case, our team included clinicians, administrators, evaluation team members, and cultural brokers. Cultural brokers are people who share cultural knowledge with immigrant and refugee youth and know how to navigate the mental health system. So during the relationship building stage at the outset of the team development, we focused really intensively on attending to those CBPR approaches of power sharing, mutual respect, collective decision making, and shared values. And then next, we practiced completing tasks collectively as a group, starting small and kind of simple and building in complexity over time to produce tools and processes for the implementation effort. As this practice of working collectively together grew and solidified, the team surfaced really complex pain points that disrupted implementation, which was both difficult for all of us and a huge win in my view, because the team could work collectively to identify really solutions that were effective. The team overall was really time intensive at the outset. And then that investment really paid off as trust built, and the team was able to kind of expand and contract their time as needed. So, what have we learned from our successes and our struggles, Laura?
So, reflecting on the implementer feedback about our own implementation process led us to conceptualize this framework shown in this image here, which highlights the importance of investing thoughtfully in an equitable structure at the outset of a project to help establish trust among implementers and partners. And this includes on the base of the triangle establishing clear roles and boundaries with well-developed job descriptions to help keep workloads manageable and empower staff to say no to work outside of the scope of their position, especially staff who are already marginalized due to their roles or social locations. Then there's the distribution of resources, so paying attention to how much pay, training, support, and time is invested differentially across staff, and ensure that staff receive the investment needed to support their work in the long term. And then the third side of the triangle is effective communications, using clear and concise communication to make sure implementers have the information they need to best fulfill their roles and also feel meaningfully included in the process, so not overwhelmed with information or kept in the dark. And then from this foundation, two strategies support ongoing effective implementation, including attending to power, so noticing power imbalances or lapses in the equitable structure as they arise, and then intentionally strategizing to mitigate those imbalances, and maintaining trust, which can be done through following through with set expectations, and then also taking responsibility for breaches in trust as they happen and working to repair the relationship. Then we have a second image, um, which represents the different approaches that we observed among implementers based on their levels of trust and power in the project. And this highlights both the benefits of cultivating trust and power as well as the risks of failing to do so. So, most importantly, in the upper right-hand corner is championing. And this happened when implementers felt invested in the project and empowered. And then they could use that to help generate enthusiasm and support for the project and facilitate implementation. To the left is persisting. So when there was high trust but low power. And we saw this among implementers who cared a lot about the work but had a more supportive role and didn't have the agency to really advocate for and champion the project. Then gatekeeping is when implementers can use power that they have to block implementation if they have doubts or distrust with the project. And then finally, burning out um, happens when implementers experience work as inequitable or unsustainable. And noticing patterns of burnout in certain roles can indicate a structural lack of trust and power and areas for improvement for the project. And for us, this included the sustainability of the cultural broker role. And so overall, just the takeaways from what we learned with our implementation experience was that even implementing an intervention with the best of intentions can replicate inequitable power structures if power and trust are not continually and intentionally tended to from the beginning. And that to mitigate that, teams can anticipate and discuss power imbalances and train staff to share power from the outset, and that accessible opportunities for implementers to provide feedback are important to identify power and trust issues throughout the implementation. And also that even critical feedback demonstrates a level of trust and an opportunity for growth and improvement. So thank you so much for listening.